Hello, everyone. Today, we're talking about the seeds of a very bright flower that blooms in summer, specifically sunflower seeds. Let's explore what effects eating a handful of these seeds as a daily snack can have on diabetes. And I'll inform you about precautions when consuming them, daily intake amounts for sunflower seeds, and more. Sunflower seeds are rich in healthy fats, contain beneficial plant compounds, and various vitamins and minerals, making them truly beneficial seeds for health. These nutrients are good for heart health and also show beneficial effects on various health issues, including type 2 diabetes. Looking briefly at the nutrients in sunflower seeds, 28 grams contains 13 grams fat, 5 grams protein, 4 grams net carbohydrates, 3 grams fiber, 36% of daily vitamin E intake, 10% vitamin B3, 11% vitamin B6, 16% folate, 32% selenium, 30% manganese, 26% copper, and various other nutrients. Sunflower seeds are rich in nutrients like vitamin E, magnesium, and healthy fat components, which have effects on lowering blood pressure and cholesterol and reducing blood sugar. And the various plant compounds in these seeds are good for reducing inflammation. Acute inflammation occurs as a natural immune response in our body, but when such inflammatory responses persist, they become chronic inflammation, which can increase the risk of chronic diseases like hypertension, diabetes, arthritis, and heart disease. Therefore, it's good to reduce inflammation by consuming foods like sunflower seeds. Sunflower seeds can be a good food for diabetes management. These seeds are rich in protein and fiber, making them diabetes-friendly foods. Experts have revealed that healthy eating habits and regular exercise can help manage diabetes healthily. Therefore, if you include seeds like these sunflower seeds in your diet, it can be a great help in diabetes management. First, let's look at the glycemic index of sunflower seeds. The glycemic index of hulled sunflower seeds is GI20, and when eating 28 grams, the glycemic load index is GL1, belonging to a very low group. What are the reasons why these seeds are good for diabetes? First, besides having low glycemic index and glycemic load index, they are rich in protein and fiber, which are diabetes-friendly nutrients. Both protein and fiber are broken down slowly during the digestive process, so they have the effect of preventing rapid rises in blood sugar. This helps with diabetes management because it prevents rapid changes in blood sugar. There are also other nutrients that are very good for diabetes. First, they are rich in unsaturated fatty acids and contain chlorogenic acid and polyphenol compounds, providing anti-diabetic effects. There is one study when 28 grams of sunflower seeds were consumed daily for 6 months, fasting blood sugar decreased by about 10%, and inflammation levels and blood pressure also decreased. It's also good for reducing diabetic complications. First, it can be a good food for heart health. Sunflower seeds contain more magnesium than almonds, which blocks enzymes that constrict blood vessels, relaxes blood vessels, and lowers blood pressure. And they are richly contained with linolenic acid and unsaturated fatty acid, which similarly relaxes blood vessels and lowers blood pressure. Sunflower seeds also contain a component called phytosterol. This component has the effect of reducing cholesterol absorption, which can help support cardiovascular health and suppress inflammation. There is one study when 28 grams of sunflower seeds were included in the diet for 3 weeks, systolic blood pressure in type 2 diabetes patients decreased by 5%, bad cholesterol by 9%, and triglyceride levels by 12%. In a meta-study that comprehensively analyzed various studies, phytosterol and linolenic acid in sunflower seeds were found to be good for preventing hypertension and significantly reduce the risk of heart disease occurrence and death. So how much of these sunflower seeds that help with diabetes and diabetic complications should we eat? It's good to consume 28 grams of sunflower seeds per day, about 1/4 of a paper cup. Rather than eating all at once, it's better to divide into about 3 portions, and you can eat them raw or lightly roast them over low heat. When roasting them, don't roast all and store, but keep them in the refrigerator and roast small amounts each time you eat them. This is because they are seeds high in fat, so there's a risk of rancidity. These healthy fats include omega-3 fatty acids, but most are omega-6 fatty acids, specifically linolenic acid. Therefore, excessive consumption can increase inflammation in the human body, so you should consume no more than 28 grams per day. An appropriate amount of linolenic acid plays a beneficial role for health, but consuming significantly more than omega-3 fatty acids can actually cause inflammation. To reduce such risks, it's good to consume them together with foods rich in omega-3 fatty acids. Consuming them with walnuts, which are rich in omega-3 fatty acids, as I always mention, would be of great help. Besides walnuts, foods that pair well include yogurt, blueberries, strawberries, spinach, olive oil, sweet potatoes, avocado, and others. If possible, I recommend consuming them together with foods that can enhance the effects rather than eating sunflower seeds alone. There's one more precaution to consider when consuming sunflower seeds. That's cadmium. Since sunflowers absorb cadmium from soil and accumulate it in their seeds, consuming more than 28 grams per day is not advisable. The WHO's recommended cadmium limit is 70 micrograms per day. The daily recommended intake of 28 grams of sunflower seeds contains about 13 micrograms, so there's no need to worry much if you follow the daily intake amount. However, if large amounts of cadmium are consumed, it can first accumulate in bones and damage bone tissue, and long-term high exposure can impair kidney function and cause chronic kidney disease. In today's video, I've shared information about the health effects of sunflower seeds, intake amounts, and how to eat them. To summarize the content, sunflower seeds are diabetes-friendly foods rich in protein and fiber, so consuming 28 grams daily greatly helps stabilize blood sugar without raising it. And they contain magnesium and phytosterol, which reduce the risk of diabetic complications. However, since they are rich in omega-6 fatty acids, it's good to consume them with omega-3 rich foods like walnuts. As a precaution, they contain cadmium, so excessive consumption is not good. And if you have kidney disease, you need to be careful when consuming them. Not only cadmium, which can worsen kidney disease, but also because they are foods very rich in potassium. If there are kidney problems, potassium excretion becomes difficult and hyperkalemia may occur, so it's better to be careful when consuming or avoid them altogether.